My name is Beverly Dunn, and I have been a nurse for 43 years. And I've had the usual aches and pains, but nothing that you would consider severe. About last year in August, no, excuse me, let's go back a little bit. Last year in March, I began to have severe right hip pain. Now, I've had right hip pain for a while, but being a nurse, you think that's just the woe of the trade. But it didn't get any better, so I decided to come see my favorite doctors, Dr. Stone, Dr. Johnson, and Jim, of course. They x-rayed my hips, and they came back and said, "My goodness, Beverly, you really don't have any hip sockets. I mean, they don't look good." And he said, "It looks like that both sides are affected with arthritis, and that you'll probably need a total hip replacement." And I said, "My goodness." He said, "Now, your pain didn't just start, did it?" And I said, "Well, it didn't just start, but it hasn't been severe. It just got severe around that time frame." I selected Dr. Stone and Johnson and Jim because I know them really well, and I've taken care of many of their patients, and it's this element of trust. I was asked why I didn't go to a hospital in Chattanooga or to a doctor in Chattanooga, but that never crossed my mind. I love my physicians, I love the hospital, and I love my family, so I wanted to be close by, and I did not anticipate having any problems, and I didn't. So we went through every detail of the surgery, what to expect, what would happen, all of the above. So even though I had knowledge, it helped to hear it again in a layman's term. So that morning I went in for surgery, and of course I can't tell you enough about my experience. Now, to tell you that it wasn't painful would not be telling you the truth, because it was a painful operation. Nothing that you can avoid, because when you go into this hip area and you have to replace that the femoral head, then that's a painful operation. But I was given sufficient pain medication in the hospital and by my physician. So I had my surgery on the 27th, and on my anniversary, which was August the 30th, was the day that I actually went home. And from that point on, I just did great. I didn't have any problems from the beginning. Dr. Stone described my hip, my bone structure, and density as that of a 25-year-old runner, but I just happened to have arthritis and spurs. So my 2-week period at home, before I had my dressing and my staples removed, was not bad. I was up and down. I had some strong support from my family. I opted to use Life Care Center's home health, and did great. They came out twice a week. My time came to go back to my physician, and I was really anxious for that, because I'm thinking, oh, I'm going to get to walk. And at the time I could do touchdown weight bearing, which is great. I mean, that's a very easy way to walk. There's some restrictions that you have, but they aren't major restrictions. Couldn't cross my legs, couldn't flex up too high, but you know, I knew that, and I did fine with that. But when I saw Dr. Stone in the office, and I went, he told me that I could go off the walker, because I had been on the walker pretty much. I wanted to make sure my hip was going to be just fine, and I could go on my walking stick if I chose to, and that was great. And that first day, I went to see my little granddaughter cheer at Cleveland Middle School, and that was just wonderful. I would advocate that if you are having hip pain, and it's so severe that it hampers what you do on a daily living, for your daily living, for your activities of daily living, I would suggest that you consider my doctors, because they are personable, they're very intelligent, they're up to date with all the modern technology, and they're just loving people.